I'm here with Dr. James Hogg. Hello.
Hi.
So, what is one of the most memorable moments that you've had at St. Paul's Hospital since you started working here in the 1970s?
Well, in the mid 1990s, we got a very large grant from the Canadian Foundation of Innovation, and that allowed us to establish a cardiopulmonary research laboratory that was interdisciplinary in nature and would bring in pathologists and physicians interested in internal medicine and basic scientists and radiologists, all working together on similar problems. And that was an exciting moment because it really provided us with the sort of lab that we had intended to build when we first moved out to Vancouver in 1977.
Thanks. And you have a reputation as a great mentor. Can you talk about why it's important to provide guidance to young researchers?
Well, speaking for myself, I had a very good experience when I was an undergraduate medical student in working with a very good researcher in pulmonary disease. His name was Dr. Ruben Cherniak from Winnipeg. And that was an inspiring experience that really got me to choose lung disease as a field of study and got me to pursue a career in research. And I think it's important for young people to have experience as undergraduates and good experience as graduate students working in an interdisciplinary laboratory where people try hard to work together to get problems, to solve problems, and I think that's really why I think mentoring is important, and I try hard to do a good job.
And Dr. Hogg, you recently received the Gairdner Wightman Award to recognize you for your contributions to improving the lives of patients with chronic obstructive pulmonary disease through your innovative research. What does it mean for you and your career to have received this award?
Well, first of all, I was surprised and extremely honored to receive the award, and it recognizes a lifetime's achievement, and in that lifetime, I have to recognize many people that helped me along the way. People like Dr. Cherniak at the start, and Dr. Macklem at the University of Manitoba, at McGill University, Dr. Castleman at Harvard at the Massachusetts General Hospital, where I spent some time, and then again coming back to Canada and working first at McGill and then moving out to UBC. In moving to UBC, I was helped really tremendously by David Hardwick, who was the chair of pathology when I first arrived, and John Dirks, who was the chair of medicine. They really made it possible for us, Dr. Parry and myself, to establish the sort of small lab that we had as a beginning, and it gradually expanded and grew over the years. And I met and worked closely with Bruce McManus, Dr. McManus, and with many others, Dr. Schellenberg and many others, to work on different projects that they've contributed to as much or more than I have, and that I would get recognized for this was an extreme honor.
Thank you so much.
Thank you so much.